challenge of clinicians, particularly orthopedic surgeons, is to have a high index of suspicion. So if you have, clinically you know where the pain is, you can guess that there is probably a fracture in that area. And that is one thing the radiologist does not have. We do not have that. We usually do not have good clinical data given to us. We can miss subtle findings. Radiographs, particularly for the extremities, should be positioned 90 degrees to each other. So when you're doing your examinations of the legs and arms, forearm, it should be AP and lateral views. But for the hand and feet, additional views requested should also include an oblique view. So it's going to for the arms, knee, thigh, leg, it's going to be AP lateral, but for the hand and the feet, it's going to be AP, oblique, and lateral. Okay, once you see a fracture, look at the rest of the film, because there are some fractures like the Essex-Lopresti, Galeazzi fracture, Galeazzi and Monteggia. These are associated with dislocations in other parts of the body. So it's a fracture in one end, a dislocation in the other end. So you should always after you see the fracture, look with a fresh eye at the other parts of the film. If in doubt, obtain a CT or MRI. If you're a beginner and if you're looking at pediatric films, it's always best to look at the contralateral side, because pedia patients with their growth plates can be confusing. It can be confusing for fractures. Okay, so how would we describe fractures that we see on X-ray? So basic thing, it's also the same thing taught in ortho, is that you start with, is it an open-closed fracture? But that part is clinical. And then you say whether it's complete or incomplete, whether it's simple or comminuted, and if it's simple, what kind? Is it transverse, oblique, or spiral? Location, left, right, and segment, proximal, middle, distal. Alignment, are the fracture segments well aligned, or is there angulation, translation, rotation, or displacement? And then is there something else going on? So these are the types of fractures. Here we have a transverse fracture, linear, incomplete, oblique displaced, a spiral fracture. In pediatric patients, you can see an incomplete green stick fracture, and here this is a comminuted fracture. How would you differentiate an oblique from a spiral fracture? Oblique fractures, okay, so this is a transverse fracture with slight dorsal angulation. So if we were to describe this, since I can't say clinically whether it's open or closed, I would say that we have a complete transverse fracture of the distal third of the metaphysis of the radius with dorsal angulation of the distal fracture segment. Okay, this one, you will see on one view, it's oblique. On the lateral view, it's also oblique. So this is actually a spiral fracture. It's not an oblique fracture, because an oblique fracture will look, in one view, it's going to look transverse. On one view, it's going to look as oblique. So I would describe this as a complete spiral fracture of the distal metaphysis of the fibula. And another example is here, again as another spiral fracture involving the distal tibia. So complete spiral fracture of the distal tibia with slight displacement of the distal fracture segment. Okay, but basically those examples are used for the long bones. How would you evaluate for fractures in other parts of the body? Cervical spine, okay. Here, the rule of thumb is you just look at these lines for reference, and then you have to look whether there is good alignment or not. So, anterior spinal line, posterior spinal line, and the line of the spinous processes. So you look for displacement. And then there are different kinds of fractures involving the cervical spine. You can have comminuted fracture involving the C1 vertebral body. You can have fractures of the odontoid process, and these are, if you're clinically thinking of that, you could ask for an open mouth view. So a fracture which will result in instant death with hanging is the hangman's fracture, which are fractures of the pars articularis of C2.